We definitely do what we call TOLACs here, or a trial of labor after cesarean. If you qualify for that and you've talked with your providers, you can absolutely try for a vaginal delivery after a C-section. We call it a trial of labor after cesarean because we're not totally sure how you'll do with it. But if you trial and then you are successful in your vaginal delivery, then it's called a VBAC.
When you're in labor and we notice fetal distress, there are a few things we can do. Sometimes it's as simple as repositioning you, and then the baby is getting enough oxygen again and that placenta can recover. There are also medications that we can give to kind of space out your contractions and let your placenta get a break. And when your placenta gets a break, then that means the baby gets a break too. If those methods don't seem to work, then we'll try a fluid bolus. So giving you more fluids through your IV will sometimes help blood flow to the placenta and then help oxygen to the baby. If your water is broken and there are certain type of fetal distress that we see, sometimes we can put a little bit of fluid back in around the baby, and that takes off a little bit of the pressure from the umbilical cord so that there's a little bit more cushion between the uterus and the umbilical cord, and it gives a little bit easier blood flow from the placenta to the baby. If those things don't work, and we're seeing again and again with every contraction that your baby really seems stressed by that, and we see that by fetal heart rate decelerations, meaning your baby's heart rate goes from a normal heart rate to an abnormal low heart rate with every contraction, then that might be a reason that we would recommend delivery by C-section. If we notice that you're having excessive bleeding, the way we manage that really depends on the stage of labor that you're in. If you're in early labor, we really try to figure out where is that bleeding coming from. Sometimes you can bleed from your cervix, which doesn't worry us too much if it's a small amount. If it seems like a lot of bleeding, then we worry more about something called placental abruption, which is a condition that the placenta separates from the wall of the uterus. If the placenta separates from the wall of the uterus, you're not getting good blood flow to the placenta anymore, and that obviously means that the oxygen to the baby is compromised, and that would be a reason for an urgent C-section delivery.